बिस्मिल्लाहिर्रहमानिर्रहीम इय्याका नअबुदु व इय्याका नस्तईन अल्लाहुम्मा सल्लि अला मुहम्मदिन व अला आलि मुहम्मदिन व बारिक सल्लि व सल्लि अलैहि। Dear colleagues, this is male young patient, almost 30 years, with history of right renal colic and for the last 7 days, and then for the last 3 days patient develop fever with rigors and 3 times vomiting at that night. Then patient took the medicine, the fever subsides. Now the patient is feeling mild renal colic, which is not so severe, and no fever is present, and urine is yellow colored, yellow discoloration of urine, and now the patient has decreased appetite. Also the severe nausea if he start taking 1 glass of water or 3-4 bites of food. So this is all about the history of the patient. Now I'm going to scan the renal area. Here we can appreciate that the kidney is bulky and the renal parenchymal echogenicity is increased, and these are the pyramids which are more hypoechoic than usual. The kidney seems to be enlarged. I'm going to measure it. This kidney is almost 13 centimeters. Now I'm going to scan the liver also. So we can appreciate that liver is hypoechoic, and if we closely observe these portal triads, which has increased periportal echogenicity. The wall of the portal triad are more echogenic than usual. Then normally we have seen many times the liver, and the liver echo texture is not normal. It is relatively hypoechoic. Hypoechoic liver means that there is edema of the hepatocytes, and periportal increased echogenicity means periportal edema is also present. Now I'm going to check the gallbladder. This is a gallbladder which is normal looking. no wall thickening is present. So we have seen the two findings. If we, number one, the right kidney is edematous, renal parenchymal echogenicity is increased, and the kidney seems to be bulky. However, the CMD is good, is preserved, relatively preserved. Its increased echogenicity doesn't mean, or hypocritical liver doesn't mean that this kidney's parenchymal echogenicity seems to be increased. It both have different findings. Both organs have abnormal findings. Liver is hypoechoic, means hepatocyte are having edema, and the portal echogenicity is increased. If we see, this is giving starry sky appearance. Look here, the left lobe of the liver, hypoechoic, periportal, increased echogenicity. Pancreas seems to be normal. Now I am going to focus the left kidney. ये पासा करो मेरे दोनों को. This is the spleen. Spleen also seems to be enlarged, and this is the left kidney, and this is also showing the increased parenchymal echogenicity. The size is also seems to be enlarged. I am going to measure it. And the spleen is also bulky, enlarged. Pelvic callaceous system of the both kidneys are not dilated. So the findings in this young patient are bilateral, bulky edematous kidneys showing mild increased parenchymal echogenicity with preserved corticomedullary differentiation, and the liver is hypoechoic with increased periportal echogenicity giving starry sky appearance. Spleen is enlarged. The liver is also 17.7 centimeter, so the liver is enlarged. So mild hepatosplenomegaly, hypoechoic liver, increased periportal echogenicity, bilateral edematous bulky kidneys with increased parenchymal echogenicity and preserved CMD. In a patient who complained of right renal colic, yellow discoloration of urine, I have seen its TLC. These are 21,000. So leukocytosis is also present. So it means that there is some systemic illness which primarily involves the kidneys, then also now has involved the liver and spleen. So it may be pyelonephritis or maybe glomerulonephritis, viral, that may be viral, that has involved the liver also. So let's see, I am referring this patient to the physician. What outcome we will have after the investigation. So my opinion in this case is patient has developed pyelonephritis / glomerulonephritis, secondary involving the liver and spleen with acute hepatitis. Thank you very much.